Welcome. Today we're diving deep into a common yet impactful illness, influenza, commonly known as the flu. We'll explore what causes it, how it affects your body, and most importantly, how to protect yourself and others. Get ready to understand influenza in a whole new light. Influenza is primarily caused by influenza viruses, specifically types A, B, and C. Types A and B are responsible for seasonal epidemics of the flu. Influenza A viruses are further classified into subtypes based on two proteins on their surface, hemagglutinin H and neuraminidase N. These subtypes, like H1N1 or H3N2, are constantly evolving, making it challenging for our immune systems to keep up. Influenza C viruses generally cause milder respiratory illness and are not thought to cause epidemics. The virus spreads primarily through respiratory droplets produced when infected people cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or be inhaled into the lungs. When the influenza virus enters your respiratory system, it targets the cells lining your nose, throat, and lungs. It hijacks these cells, using them to replicate itself. This replication process damages and kills the cells, leading to inflammation and irritation. The inflammation triggers your immune system, resulting in the characteristic symptoms of the flu, such as fever, body aches, and fatigue. In severe cases, the viral infection can spread deeper into the lungs, causing pneumonia, or even lead to systemic complications affecting other organs. Influenza is a global health concern, affecting millions of people each year. Seasonal epidemics typically occur during the fall and winter months in temperate climates. The exact timing and severity of these epidemics vary depending on factors like the circulating viral strains, the level of population immunity, and public health measures. Certain populations are at higher risk of developing serious complications from influenza, including young children, older adults, pregnant women, and individuals with underlying health conditions like asthma, heart disease, beats. The symptoms of influenza can vary from mild to severe. Common symptoms include fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and sometimes vomiting and diarrhea, especially in children. It's important to remember that not everyone with influenza will experience all of these symptoms. The severity of symptoms can also depend on the specific influenza virus strain and the individual's overall health. Diagnosing influenza usually involves evaluating the patient's symptoms and considering the prevalence of influenza in the community. Doctors may also use rapid influenza diagnostic tests, RAIDs, to detect influenza viruses in respiratory specimens collected from the nose or throat. These tests can provide results within minutes, but they are not always accurate. A more sensitive test, called a reverse transcription polymerase chain reactions RT-PCR, can also be used to detect influenza viruses, but it typically takes longer to get the results. Influenza is broadly classified into types A, B, and C. As mentioned earlier, types A and B are responsible for seasonal epidemics. Influenza or viruses are further classified into subtypes, such as H1N1 and H3, based on the hemagglutinin, H and neuraminidase N proteins on their surface. These subtypes are constantly evolving through a process called antigenic drift, which results in minor changes in the viral proteins. Occasionally, a major shift in the viral proteins can occur through a process called antigenic shift, leading to the emergence of novel influenza subtypes with the potential to cause pandemics. Influenza B viruses are classified into lineages, such as Victoria and Yamagata. Influenza C viruses generally cause mild respiratory illness and are not thought to cause epidemics. The treatment for influenza primarily focuses on relieving symptoms and preventing complications. Antiviral medications, such as oseltamivir, Tamiflu, and zanamivir, Relenza, can be prescribed to reduce the severity and duration of illness, especially if started within 48 hours of symptom onset. However, these medications are not effective against all influenza strains and may have side effects. Other treatments include rest, fluids, and over-the-counter pain relievers and fever reducers. In severe cases, hospitalization and supportive care, such as oxygen therapy, may be necessary. The best way to prevent influenza is to get vaccinated each year with the seasonal influenza vaccine. The vaccine protects against the influenza viruses that are expected to be most common during the upcoming season. Other preventive measures include practicing good hygiene, such as washing your hands frequently with soap and water, avoiding touching your face, and covering your coughs and sneezes. It's also important to avoid close contact with people who are sick and to stay home if you are feeling ill. The prognosis for influenza is generally good, with most people recovering within a week or two. However, influenza can be more serious in certain populations, leading to complications such as pneumonia, bronchitis, sinus infections, and ear infections. In rare cases, influenza can lead to death. Recent research is focused on developing more effective influenza vaccines that provide broader and longer-lasting protection. Scientists are also working on developing new antiviral medications that can target a wider range of influenza viruses. Furthermore, advances in diagnostic testing are helping to improve the detection and management of influenza infections.